Talks. My name is Trishant, and I thank you all for attending today's event on Zoom and to those watching on YouTube Live. For those of you who have attended a Vishwa Talk before, a warm welcome back. And for our new joinees, here's a little bit about us. Vishwa Talks is a platform to create awareness amongst people and protect our social heritage and to let people make their own decisions. Here we invite experts to discuss and explore diverse opinions, different perspectives, various issues, problems, and their solutions on various fields, including art and culture, healthcare, environment, education, and many more. Each webinar is an interactive session with a deeper understanding of the topic at hand. If you miss any part of the session or would like to go through the previous sessions, kindly visit our website, vishwa.org, or Vishwa Talks YouTube channel for a full library of past Vishwa Talks on various interesting topics. It is my pleasure to welcome our distinguished speaker today, Dr. Divya Bhatt, a respected periodontist, academic researcher, and author from Bengaluru. Dr. Divya brings with her 13 years of teaching experience at RV Dental College, Bengaluru, along with a strong academic and research background. She has contributed several papers to national and international journals and has been actively involved in advancing dental education and evidence based periodontal practice. She is also the author of the widely appreciated textbook Case History Recordings in Periodontics, a practical resource that has become familiar to generations of dental students and practitioners. Today, we are truly fortunate to have her with us to share her knowledge, experience, and insights with our Vishwa Talks community. Dr. Divya, it is an absolute pleasure to have you with us. On behalf of everyone, I warmly welcome you and look forward to an enriching and insightful session on more than just a smile. Discover the connection between your oral health and systematic health. A very good morning, ma'am. Just a moment. Yeah, you're unmuted.
Thank you so much. Thank you for this warm welcome.
You're welcome, ma'am.
Is my slide visible?
Not yet. Just a second.
Mhm.
Not yet. Just your screen is not shared at the moment.
Yes. One moment. Yes.
Yes, ma'am. It's visible.
I'd like to welcome everyone to this talk. Thank you so much for being here. So today's topic is more than just a smile. Let's discover the connection between our oral health and our systemic health. So without much ado, let me begin. Today, I will be touching upon our oral and health regarding our gums. I'll be talking about various dental myths, what we believe, and what is actually the reality. And I'll talk about how the oral health and systemic health are connected. They're not two different systems, it's interconnected. I'll talk about how to take care of our oral health, whether it be nutrition or the brushing techniques. I'll talk to you about the causes of bad breath and how our oral cavity is a mirror to overall health. So a lot of conditions are actually detected when you go to a dentist. And at various age groups, how what we have to look out for. And I'll just tell you how often we need to go to a dentist. So these are the topics I will touch on. So let's start with oral disease. I think this is a very familiar topic. All of you would know when we have something that is disturbing our oral cavity. So what are the most common things that we would see? I think this is something that all of us are familiar with, right? So most common is tooth decay. So we can see discolored teeth when our tooth is decayed, or we may suddenly have that sensitivity and we can't have something cold, or that gnawing pain when we eat something. So this indicates that our tooth is probably decayed. Or it could be gum disease. This also people would be very familiar with because it's very common. When we brush and we spit, we can see blood-tinged saliva, right? We can see shaking teeth. We can smell something bad coming out from our mouth. or we can feel that food is getting stuck between our teeth, right? So these are commonly seen during gum disease. And then we may also see certain lesions, which we can see in the lining, right? Either we can see inside of our cheeks, or we can see in the inside of our lips, or on our tongue, we can see certain lesions, like it can be coated, or there can be ulcers, or there can be burning. You know, your mouth is burning and you would like to visit the dentist and ask them what is going on. So these are the most common conditions in the mouth, and I'm sure all of you are very familiar with it. Now, let's talk about the gums per se. What are the afflictions that affect our gums? So you can see the picture on the left top. That is how your healthy gum should look. You see that it is pink in color and it is firmly attached. There is no kind of bogginess. And this is how, and nor there are spaces between the teeth, right? This is how a healthy gum looks. Now, if you see the second picture on top, you can see that the gums are boggy, right? You can see that, you can make out when you see the margins of the gums, it looks very boggy. It looks red in color. It could also be bluish in color if the infection has been there for a long time. And generally, when you brush your teeth in such times, you will find that there is bleeding, right? And if you see the third picture on top, you can see that the gums are enlarged, right? The size has increased. And this is, it could be because of the gum infection because you have not kept your teeth clean. It could also be because of certain hormonal conditions like in pregnancy or puberty where the hormones have increased. It could be because of diabetes. We'll come to that later. It could also be because of certain drugs that we are taking. Like if we are on certain BP medications, or we are on medications for epilepsy or immunosuppressants, then we can find these gum parts which are looking bead-like. If you see it is enlarged and it's looking bead-like, then probably it's a reaction to your drug. You can go to your dentist and they will change your drug for you so that this subsides. And then these are the diseases of the gums. Apart from diseases of the gums, you can also have diseases in between the tooth and the gums, right? This is what we call as periodontal or periodontitis. So apart from just the gums, you have tissue which is connecting your teeth and your gums, right? Whenever that tissue gets infected, it's called as periodontitis. So how do you know that you have periodontitis? Usually you will have shaking teeth, right? Once that support is lost, then your teeth start shaking and you may even have gaps between your teeth because the support to the tooth is gone and the teeth start moving from their original place. Or it could also be that you're not even able to make out, right? You go to the dentist and he is going to examine and he can see that a gap is formed between your gums and the teeth. So he could be identifying your problem. So these are the common gum conditions that you come across. So now let's come to the next part. So some of the things that we have seen people come to us and say, and then we realize that this is a common myth that is there in the population. And here, let me just be a myth buster for you today. So what is this we are talking about? We are talking about tooth powder. So is it a good idea to use tooth powder? When I got married, my husband's grandfather used to use tooth powder and he was very fond of it because he used to be like, this really cleans my teeth and my teeth are like shining. And that may be the case. It may be effective. But what happens when you use tooth powder? Tooth powder has 90% of abrasives, whereas your toothpaste has only 20 to 40%. So imagine the difference. So yeah, you're cleaning away everything, but your teeth are also getting worn off, right? So tooth powder is not a good idea. Please do not use it. And in India, people also use things like ash, rangoli powder, brick powder. Okay, please do not use any of these, though they may be very effective, but along with the germs, they're also going to remove parts of your teeth. So do not use them. So which toothpaste do we use? Every day we have some ads, right? We have, recently, I think Kriti Sanon is the recent most purple toothpaste. Very attractive. Even I was tempted to use it, right? So you go to your shop, you go to the mall and you have like so many types of toothpaste and there are, crystals which are making your, mouth fresh, and you have salt and you have charcoal. And my friends were teasing, they were saying maybe next week come out with chaat powder, chaat masala. So which do we use? This is the confusion, right? Use any toothpaste. Okay, that is my thing. Because it doesn't matter which toothpaste you use toothpaste, not tooth powder. That is important. All the toothpastes are essentially the same. What matters is how you brush your teeth, which we will be talking about later. Type of toothpaste doesn't matter. Now we will come to some common myths that we have about infants and children. There may be many people here with young children or infants in the house. So they might have wondered some of these things, and let me talk about them. So other day we went to a restaurant, and in front of me there was a young child who kept putting the thumb into the mouth. Every 2 seconds, she was hungry, obviously, because they were not serving the food. To make it worse, they were opposite us. They gave us the food, but not them. So she was clearly distressed. So she just put her thumb in her mouth and she was sucking on it. And every 2 minutes, her mother kept pulling it out. So this, I think all of us can see very often wherever we go. And if I weren't a dentist, I would have thought this is the correct thing to do. But thumb sucking is a very common habit. And until the age of 6, it doesn't cause any problem. In fact, when we get stressed, what do? We may pace around and things like that. When children get stressed, what do? They suck their thumb. So this is basically a response to their stress. Allow them to do it. Up till the age of 6 years, there is no problem. Because at the age of 6, you have your permanent teeth erupting. At that time, if they are going to continue, it's going to cause your teeth to get to move, and it will cause your arch to narrow. Okay, so it will cause basically teeth problems, which will have to be corrected later. So at the age of 6, if they're still continuing, take them to a dentist and the dentist will take care of that. Until then, let them suck their thumb. Don't keep pulling it out. It's an endless battle, right? You're pulling it there, putting it back. So it's okay till 6 years. Should we clean, when should we start cleaning the oral cavity of children? So you can start at birth. So whatever milk is getting stuck in their gum pads, there may be bacteria lodged in it. So it's a good idea. You can cover your finger with a clean cloth and just wet it and wipe all the areas on the gum pads. What do we have on the right? It looks quite distressing, right? So a lot of people, what they do is that to allow the child to sleep, they leave the feeding bottle in the child's mouth and they allow the child to go to sleep. What happens is milk, even breast milk, has some natural sugars, right? So the sugars in the milk are going to cause decay because the bacteria are going to act on it and release acids. So what you see here is this poor child has all the front teeth decayed, right? This is called as nursing bottle caries. So what I suggest is once the child goes to sleep, please pull out the bottle and gently clean up the teeth so that there is no sugar left. Please don't leave it when they go to sleep. The next thing, this is a very common thing. We have a lot of people with, children with decayed teeth who say that anyway, it's a milk tooth, it's going to fall off, right? Why should we bother treating it? And they ignore it because they think this is not a permanent tooth, it's going to fall off and new teeth are going to come, those are going to be fine, we'll take care of it. But that's a very bad idea. Why do we need to take care of decayed teeth even in young children? One, of course, it's uncomfortable, right? Imagine leaving decayed teeth. Whatever symptoms you have, they would also have the same. They'll have pain, sensitivity, they can't eat, right? But that is one aspect. The second aspect is those teeth are maintaining space for your permanent teeth to erupt. When you get it extracted, when you get those teeth pulled out, that space is going to close. The teeth behind, the permanent teeth behind are going to start moving in front and closing the space. Then what will happen, as you can see in this picture, those two premolars are side by side rather than one in front of the other. So please take care of the teeth, get them filled, get them replaced, even if they are milk teeth, right? So now we will come to we have covered in children what should be done. Let's come to adults and we'll talk about common misconceptions that you can see in adults. So what is this strange picture? We have an eye inside a tooth. So this is just for effect. So basically, when we were in dental school, we'd come across a lot of patients who had, these severely decayed teeth causing a lot of pain and there is, pus accumulation, but they would not get it removed because they would say, if I get it removed, I can't see. This was a common misconception that if you get decayed teeth extracted, it's going to affect the nerves in the eyes and eyesight gets affected. Either you can see poorly after that or you go blind. There is no connection between your teeth and your eyes. But if you do not get those decayed teeth removed, it can cause abscesses, it can cause pus accumulation, which can later cause bigger infections. To please get your teeth extracted. It doesn't cause any problems to the eyes. The other thing is that once you have removed the tooth, should we get it replaced? This is the question. So if people are able to eat fine, they're like, why should I get it replaced? It's fine, right? No, it's not. So let's talk about why it's not fine. As you can see in this picture, when a tooth is removed, there is a tendency for the teeth behind the removed teeth to move forward. There is also a tendency for the teeth opposing it to move down to cover that gap. So what happens when this happens? Good, no, let it all move. We can eat better. Okay, that tooth doesn't have to be replaced. No. What happens is your bite is spoiled, right? When those teeth move. And also those teeth which have moved can lose bone support and there will be problems in those teeth later. So please get your teeth replaced. It's not a good idea to leave it as it is. Now we come to one more thing, that is cleaning, right? Many people, this people don't have a problem. They come to get their teeth clean. But after they get their teeth clean, what happens? They feel sensitivity. Oh, I went to the doctor, I got my teeth clean, and now all are sensitive. I was able to eat ice cream earlier, now I can't, right? Or they feel that their teeth, which were not shaking previously, have started shaking now. Or you can see in the third picture, they start feeling there were no gaps between my teeth before, and now there are gaps between my teeth. This doctor has done something, right? So has the doctor done something? Yeah, he has removed whatever calculus or debris was there on your teeth. And we have these, what is calculus is basically, you might have noticed on your teeth, some hard deposits are present, right? These hard deposits that are there, they may be covering something which, they may be covering areas which are sensitive. That's all it has done. It cannot really remove or cause sensitivity as such, but those deposits which are not good for your teeth, for protecting your teeth from feeling sensitive. Now that it's gone, you can feel that sensitivity. Same thing, sometimes these hard deposits are holding your tooth together like a bridge, right? So when you remove it, you can make out how much they're actually shaking. Has the treatment caused it to shake? No, it was shaking as it is. But when we have removed the deposit, you can make out how much it is shaking. So should we not remove it? We'll put it back. We'll just paste it back. No, because that is what has caused the disease in the first place. That is what is making your teeth shake. So it will continue and the disease will get worse until you eventually lose your teeth. So it's a bad idea. Even if it is shaking, you will actually get to know how much it is shaking and get the treatment for that. So you have to get teeth cleaned. Also, the gaps that you can see, also those gaps might have been covered by the dental deposits, which you couldn't make out. Now that the dental deposit has been removed, you can make out these are the gaps that I had. Will it come down? Maybe a little bit once the inflammation heals. Some of it may get covered, but not entirely. Please do get your teeth clean because that is what is causing all these problems, right? The cleaning is not causing the problems. The disease is causing the problems. And the last myth that I'll be busting is it normal with age? You know, they say that I have lost all my teeth, but it's okay. I have crossed the age, right? This is a normal phenomenon. Is it normal for everybody to have to lose your teeth? No, it's not, right? So why do we lose our teeth? We lose our teeth because of neglect, right? Lifelong, the inflammation and trauma that the teeth have been subjected to, because of that, we lose our teeth. So what should we do? We should go for regular dental checkups. If we take care of our teeth in our younger days, they will serve us. They will be our best friend till we grow up. It is like any relationship in life. You serve it well, it will be there till the end. So we'll come to the topic of oral health and systemic health. So a lot of people are curious, right? Something that is so far away from the organs. The heart is somewhere, the liver is somewhere, the mouth is somewhere. How can our mouth possibly cause infections elsewhere in the body, right? It would be so nice if it was a separate entity. I will just submit it. It will be clean and I will put it back. But no, that doesn't happen. It's connected to the rest of our body. So just imagine if you had a lesion on your hand, suppose your hand got burned or there was a cut on your hand, the size of your palm, right? Imagine how many bacteria would seep into that. Such a cut would you ignore? Would you ignore a cut which was the size of your palm and just, go around as if nothing has happened? No, right? But this is inside your mouth, so you can't see it. Okay. Why is it happening? One brief thing I would like to talk about inflammation without going into depth. So what happens in our body is similar to, imagine there's an intruder in your house, right? You can hear some sound outside, you're watching TV. What do? You get your broom. Okay. We are like, okay, let me attack this intruder. So the intruder comes in and you start hitting with the broom. Meanwhile, because you're not used to hitting intruders, you break a few pots and you break a few jugs in your house, right? So this is basically inflammation. Whenever there is an intruder into our body, right, like a bacteria or a virus or a foreign substance, what happens? The body tries to fight back. That is inflammation, right? That is what you are doing with your broom. And in that process, what happens? You also destroy or damage some of the things in your body. Like you end up damaging things in your house with the broom. Similarly, inflammation also ends up damaging things that are in your house. And this is how actually the inflammation that is there in your mouth is also connected to the rest of your body, right? One thing is what connects your mouth to the rest of your body? blood vessels, right? You have blood vessels which are connecting your mouth to the rest of your body. And these blood vessels act as a passageway through which one bacteria can go from your oral cavity to the rest of your body. And also, when there is inflammation, you have certain chemicals which get released, which can also go to other body parts of the body and cause damage. Is it clear? So why I have put up this picture of the hand is, like I told you, gum disease, there is also a part of our gums which is facing our tooth, right? It's not only facing outside, there's a part which is facing our tooth. So that part which is facing our tooth, there it will open up. When you have disease, it will open up and it will allow access into your bloodstream. So whatever bacteria and inflammatory mediators, the chemicals which are produced, will go freely into your blood, right? So what I have shown is initially how much of area is exposed, we can't make out. Seeing the picture on the left with relation to the teeth, can we make out? No. But when you see your hand, you can actually make out. So the first picture is when you would have first gone with that much of disease, how much of area is exposed. And the rest of the pictures is after treatment, after 10 months of treatment, how much of area is still exposed. So you can imagine the wound is closing down and the amount of access that your bacteria and your chemical mediators have to go into blood is reducing. So you understand why it is important to clean your teeth, right? This picture is quite of self-explanatory. So how is it related to diabetes? Okay, diabetes, I think, is a very important topic. All of us would like to know about it. So very briefly, what happens is, what helps in reducing the glucose in the blood? We all know it's insulin. I don't think there is anything here, right? So what happens when there is inflammation anywhere in the body? We have receptors for insulin. You can see the blue receptors here. Those are receptors for insulin. So insulin needs to sit over here and it acts as a key. So it will open the lock and the organs which metabolize glucose will allow the glucose to go inside and it will get converted to energy to do whatever work. Like if it's a skeletal muscle, then it gives us energy, right? So what happens in case of inflammation? There are chemicals which are going to go and sit at this receptor, not allow insulin inside. So when insulin doesn't get connected to the receptor, the glucose stays in our blood and causes all the problems that we see in diabetes. We know that glucose is more in our blood in diabetes, right? So this is how inflammation anywhere in the body, including the oral cavity, which I told you just now, such a rich source of bacteria and inflammation, right? Because of that, this can cause increase in the glucose levels in blood. Next, we come to heart disease. How can, oral disease cause heart disease, right? Let's talk about that. So what happens, you can see that the blood vessels are like tubes, right? You have blood vessels just like pipes in your washroom, right? Now these pipes can get clogged. What happens when it gets clogged? Movement is restricted. Or you can also imagine it as traffic in Bangalore. I think that everybody is very familiar with, right? So you have construction or road work happening on both sides. What happens? Very irritating, right? Everybody's slowed down and you cannot reach the point of destination, right? So that is what happens. When we have inflammation anywhere in the body, you can see these blood vessels. This is the normal healthy blood vessel. And you can see the one on the right? It is clogged with fat, right? So what happens is that inflammation allows the fat to enter into your blood vessel walls, right? You have like a barrier. You have a healthy barrier usually normally, which will not allow anything to go inside the blood vessel wall, okay? But it's like in, the Trojan horse is allowed inside, right? So like that, when there is inflammation, the fat and the white blood cells are allowed inside into this layer, and the white blood cells eat up the fat and they die and they keep increasing the fatty layer here, right? You can see how clogged it is getting and the blood vessels are not able to move, right? So this is an example of how the blood supply, if it happens in the heart, what happens? You'll have a heart attack, right? The blood supply can be reduced to the heart muscles and they will not be able to pump blood anymore and you can have a heart attack. Another thing that can happen is this may break, right? Whenever there is any break anywhere, what happens? Platelets rush in, right? They have to form a clot to repair. So the clot itself can obstruct the blood, as you can see here, or the clot can get dislodged and go into your brain through the blood vessels and it can lead to a stroke. I've gone a bit technical here, but I wanted you to have some idea as to what is happening. So basically what is happening, the blood supply is getting reduced. And so your heart may not be able to pump blood properly. You could have a heart attack. or a clot may get dislodged and go into your brain, and there can be a stroke. So this is how inflammation can perpetuate all these changes. Pregnancy. It's very important to take care of our gums during pregnancy. One thing is pregnancy itself can cause our gums to be boggy. Okay. So in pregnancy, what happens? The hormones are increased, right? You have increase in progesterone and estrogen, basically which is required a part of a pregnancy. But these can also cause boggy, bleeding gums. That is one reason you should get your teeth clean. But if somebody is planning to get pregnant, it's a good idea to get your teeth clean before pregnancy itself, before these hormones can increase. Because once the fetus is forming, it gets more and more complicated. But you can get cleaning done anytime of pregnancy. Second trimester is best, but you can get cleaning done. It's a good idea. Because again, the bacteria that are there in the mouth, you have so many billions of bacteria in your mouth, they can enter into your amniotic membrane, and there can be many issues that can be there. Like there can be a miscarriage, or there can be preterm birth, like the baby may be born early, in which case the baby can be underweight and the immune system of the baby is not developed. Baby can be predisposed to many infections. So it's a good idea that if you're planning to get pregnant, get your teeth cleaned before, or even after you find out that you're pregnant. It's a good idea to get your teeth clean at any time that you feel there are deposits. Lung disease. I will not be going into detail into the next few. We know that there are many bacteria in our mouth, like I mentioned. There will also be viruses and things like that, which can be lodged, which can get access into our lungs through the bloodstream. Okay. So that can lead to lung disease. And what are the other conditions? Very briefly. So you just imagine the plethora of conditions. Can you imagine? See this circle, how many conditions are linked to oral disease. So I suggest you go to your dentist today and get your teeth checked, get it cleaned, right? The basic cleaning, let's get it done. So it can lead to viral infections, rheumatoid arthritis, osteoporosis, cancer. It can cause adverse pregnancy outcomes like premature birth. It can cause irritation in your digestive tract. It can lead to kidney infections, liver infections. It can cause diabetes. It can lead to heart disease and lung disease. It can also lead to Alzheimer's disease, right? So please go and get your teeth checked today. Now, how do we clean it at home? Okay, we can go to the dentist, but can the dentist come home and clean our teeth every day? If your spouse is a dentist, then maybe yes. Otherwise, even then, I doubt that your spouse will be willing to clean it every day. For the children, maybe. So what do we use? Right? So we have to, let's start with how much of paste do we use, right? So we need very little paste. Okay, paste is quite abrasive. We don't need too much of paste. It's going to wear away our teeth. And the paste is the main thing that's cleaning our teeth. Huh? Let's remember that because it has abrasives in it. So in children, you have a special paste. Okay, you have paste with lesser amount of fluoride. Fluoride is required because we don't want our teeth to get decayed. So fluoride is required. But in children, we don't have so much of fluoride because it will cause staining of the teeth. Okay. So we have a children's paste till 6 years. You have to use a children's paste. And the amount below 3 years, can you see the picture on the left? Just this much, the size of a rice grain. That's it, that they require. In older people, about 3 years, you can use the size of a pea. That much is enough. You don't need more paste than that. If there's too much foam, it's even difficult to clean it, right? You'll keep spitting. That much paste is enough. Which brush do we use? Again, Ayushmann Khurrana has said you can use crisscross bristles. And then you have like various head designs and various colors and such fancy brushes nowadays, right? You have again so much of choice. Use whichever one you want. There is no problem. Whatever you like. You like Ayushmann Khurrana's brush, though I don't know whether he's really using it, he's advertising it. You can use whichever one. But use a soft bristle brush. Do not use a hard bristle brush for sure, because again, it's going to wear off your teeth. Why is it there? That's what they ask. Why is it there in the market if you're not supposed to use it? You can use it for cleaning your dentures. Okay, hard bristle brush can be used to clean your dentures, but you can use a soft bristle brush. Anyone, any color, any design of your choice. A powered brush. How about a powered brush? There are so many in the market. So you may be wondering, what about that? Does it help? Yes, definitely. Powered brushes are better than your manual brushes. But if you're brushing properly, if the technique is right with your manual brush is also enough. But if you have some condition in which you're not able to brush properly, like you have arthritis or something like that, where you're finding it difficult to hold a brush, then it's a good idea to invest in a powered brush. Otherwise, it's up to you. If you like it, you fancy it, go ahead, please use it. It's very effective. If you don't, a manual brush is also fine, right? How long do we brush? It's not like another task, just finished brushing. This is what children do usually. If I see my son is in and out, I'm like, did you brush your teeth? Yeah. But you know, how long, how fast have you brushed? In 30 seconds, he's in and out of the bathroom, right? I'm like, really, show me once. I want to see it. So it's like, you know, you have to brush for 2 minutes a day. You can start off even by keeping an alarm, or you can, once you practice, it will become a habit, because the teeth are, like, as you can see, so inaccessible, right? You have them placed in various positions. It's difficult to reach some areas in our mouth. Okay, so it's a good idea. You have to brush compulsorily 2 minutes and twice a day. Why twice a day? Night we feel lazy now we're sleeping. Now I have to brush tomorrow. From tomorrow I will brush twice. The tomorrow never comes, right? We had this Naleba in Bangalore where people used to write Naleba on the door. The ghost will never come next day. This is what will happen with our brushing also. You will not brush the next day. Do it from today only. Brush twice a day. Okay, because again, it's the same reason that the teeth are so difficult, no, inaccessible areas. In one time, you will not be able to remove the entire plaque. You need to do it twice so that within that 24 hours, you have managed to remove all the plaque. Okay. How to brush? This is the most important class. So please pay attention. How do we all brush? Most people brush like this. Okay. Horizontal brushing technique. Keep it at 90 degrees and brush your teeth. This is not good for your gums. Okay. And it's not good for your teeth either. You can see these lesions. Okay. These abraded surfaces on the teeth, this wedge-shaped defect in your tooth. This is going to cause the sensitivity. The scaling is not causing. This is what is causing the sensitivity, right? So, and can you make out the gums are going up, right? Exposing the root. So that is what happens when you have a horizontal brushing technique, right? No one tells us this. Actually, more than going to the dentist, that is important. Huh? Don't take the message. Don't go to dentist, brush properly. Brush properly also, because that is in your hands. So the technique that you should use is you should keep the bristles at 45 degrees, right? Keep the bristles at 45 degrees, as you can see on the picture on the left. And you have to brush 3 teeth 5 to 6 times. Okay, brush it like this at 45 degrees and then move it gently down. Okay, the name is not important. Let's not go into that. If you feel this is a very difficult technique, okay, keeping it 45 degrees is a must. You can see the picture on the right also where I've shown you how it looks when you keep it at 45 degrees. Keeping it at 45 degrees is a must. After that, if you feel that it's difficult to move it side to side and move it down, just move it down. That's also okay. But make sure it's at 45 degrees. It is at the region between your teeth and your gums, and 3 teeth at a time. And all the surfaces have to be brushed. Okay. So make sure that three teeth at a time, even inside your oral cavity also, on the face of the near the tongue, keep it at 45 degrees and move it up. Okay. And also the areas above your teeth, please put pressure on it, on those pits, and move it back and forward. And also inside, right? Inside your front teeth, where your entire brush may not fit, use the head of the brush, right? Use the head of the brush and move it up and down. This is a technique which is used for people with braces or people who have got surgery done, right? If you're going to irritate those parts, if you're going to put it between the tooth and the gums, it'll start bleeding again if you have had surgery. And if you have bristles, it may not, if you have braces, it may not clean the top of the braces, right? So for that, you keep it in the opposite direction. Instead of facing the gums, you face it below, right? So the bristles have to face below, and then you can clean it. How about the areas between our teeth? How do we clean the areas between our teeth? So this depends on how much of space is there between our teeth, right? So between our teeth, if we have no gaps, then we are going to use a dental floss. All of you have seen a dental floss. It's like a thread that we are going to insert between our teeth and clean that area where there are tight contacts. If you have spaces, if there are areas between, if you can see the picture below, you can see that there is a small gap between the two teeth. Then you can use something called as an interdental brush. Okay. I hope you can see it. And you can see it in the picture also. This is what you're going to insert between your teeth when there are small gaps between your teeth. Tongue cleaning is very important because the tongue is a area where many bacteria can get lodged, right? You may have a coated tongue, and it's a place where your bacteria love to live. Okay, there are a lot of places in between your tongue where they can sit happily, and they'll also cause bad breath, right? When your tongue is coated, you would have observed when you have fever or something like that, your tongue may be coated, you will have more bad breath, right? So it's a good idea to clean your tongue every day. You can invest in a tongue cleaner and scrape it from back to forward, or you can even use your normal toothbrush without paste. That's also okay. You can use either of it. Mouthwash. Do all of us need to use a mouthwash? No, not all of us need to use a mouthwash. Who needs to use a mouthwash? If you have bad breath, then yes, we can use a mouthwash. Or after surgery of our gums, where we can't keep our teeth clean, then we can use a mouthwash. We can use it if we have any denture associated infection. Okay, we wear dentures and those dentures have got infected. We can soak those dentures in a mouthwash. Or people who are finding it difficult to brush. This is basically anyone who finds it difficult to brush. Like if people have had a stroke or people have had arthritis and they can't hold the brush properly, then you need to use a mouthwash. Or if you have a lot of fixed appliances in your mouth, or you're wearing braces and you can't clean your teeth properly with the brush, then go ahead and use a mouthwash. Nutrition, I will not go into in detail, just briefly, because all of you know, don't eat sugary food, right? Sticky food, if you're going to eat, please rinse your mouth, right? Sugar and even acidic drinks, like if you have a lot of orange juice or you have a lot of soda, that is bad for your teeth. It is going to erode your teeth. What should you have? This is also very common sense. All of you would know it. Have more nutritious food. Milk products are very good because you get your calcium and vitamin D with sun exposure. And also have a lot of fibrous food. So fibrous food, one, it meets your dietary needs. Okay. And the second, it also cleanses your teeth surfaces. So should you smoke? I think this is this is a question that doesn't need to be asked. What happens when you smoke? Okay, so smoking is a habit which has a lot of deleterious effects. So it can basically, it will reduce your saliva. It will cause bad breath. It will a lot of bacteria increase in our mouth. Those bacteria are responsible for causing gum disease. And we all know the main worry that we have is also of oral cancer. And it can reduce our immunity. So smoking is definitely bad for our oral cavity in many ways. Other than that, some habits that may not be so common, but you might have come across. One is mouth breathing. Especially in children, you might have seen when they sleep, they may be sleeping with their mouth open, especially because of enlarged lymph nodes, because they are very predisposed to cold, right? At that age, and they may have enlarged lymph nodes, they may be sleeping with their mouth open. Pay attention. If that is the case, the gums which are there in front, they will have a reddish line like this, which means that probably they are mouth breathing. You can take them to the doctor, they will help you out. Or another thing, observe your partner in their sleep if they are grinding their teeth, right? If they're grinding their teeth and there is a sound, or when you wake up in the morning, if you're getting a pain in your ears, you could be grinding your teeth. And if you're grinding your teeth, those forces may cause this kind of lesion. Can you see it here? You can see the second picture where your teeth are completely worn off, and there could also be pain. Okay, so this is a good idea. If your teeth are getting worn off, or you're seeing that there is a red margin in your gum, these could be because of certain habits. Please visit your dentist. What are the causes of bad breath? I think this is something we would like to know. No? If our mouth is smelling, then we are really worried, and we have all these space that they're saying, you use the space and then you can go, and then, suddenly you are very attractive. What is causing the bad breath though? So bad breath can be either because of something in your mouth. I think it's clear in our conversation now. What could that be? Anywhere where food is getting stuck. It could be a decayed tooth. It could be an infected gum, right? Where food is getting retained. It could be because of less saliva. Actually, this is the reason in the morning, also early morning, we all have a bad breath, right? If someone comes and talks to us, we'll cover our mouth and talk because we are afraid we have bad breath. So the saliva is less in the morning. Once you rinse your mouth, immediately that goes away, right? So anything that causes reduced saliva, smoking, eating something which is smelly, that of course can cause bad smells. Healing wounds after extraction, which could be infected wounds, also can cause bad breath. Or any infection, like your infection in your throat, infection in your sinuses, infection in your lungs, liver and kidney diseases, certain medicines. Diabetes, if it's causing a fruity smell, that is something to be concerned about. You should go to your doctor. Right? These are the various causes of bad breath. Oral cavity, I'm coming to the end of the talk. So oral cavity is a mirror to oral health. So a lot of times what happens is when you go to a dentist, he can see that you have soft gums, you have bleeding, severe bleeding, and you have a lot of teeth which are shaking. You have lost a lot of teeth already. And sometimes you have something called as abscesses. As you can see here in the picture, you can see that pus-filled lesions are filled in your mouth. Then definitely the dentist will say, have you got your sugar levels checked? And when you check it, sometimes you will find they're high. So many times dentist is the first person to find out you're diabetic, and then they will refer you to a doctor. So it's a good idea to go to your dentist even for this reason if you haven't had enough reasons already, right? So now we will come to at different age groups. What are we suspecting? What conditions are we suspecting? In children, viruses can cause oral infections like herpes virus. This could cause burning mouth. They may have had fever, and after some time, they're saying they can't eat. They're very cranky. Okay, they feel they can't eat and swallow. They can't have anything hot and spicy. Up to the age of 6, herpes can cause gingival gum infections in the mouth. Or it could be also you have, new teeth coming in, old teeth falling off. There is so much of mess. They can't clean their teeth properly, right? And they're in different positions, these teeth. So cleaning becomes very difficult. So this could cause gingivitis. Third reason that there could be gum disease in children is puberty. Okay. So in puberty, you have a lot of hormones which are increasing, and this can change the bacteria that are there in the mouth. And this can again cause these bleeding, red gums can be caused because of that. It's a good idea to get the teeth clean. In adults, what do we see? We have already covered it. So I'll just mention it here. You can see either gingivitis or periodontitis. Gingivitis is when your gums are red and bleeding. And periodontitis is when your teeth start shaking too. It could be very early, they may not shake. When you go to the dentist, they may tell you you have periodontitis, right? And in women of a certain age group, 40 to 50 years, there is an autoimmune conditions also are very common. There you can have burning in the mouth. It's not seen and it's not very common, but if women in 40 to 50 years are experiencing burning, it could be a perimenopausal change or it could also be an autoimmune condition. Please go and get it checked. And last, we come to senior citizens. Like I mentioned, tooth loss is not because of age. It's no excuse. You cannot say, I am old, that's why I've lost my teeth. No. Age is not a reason for losing teeth. Neglect is. So please go and get your teeth checked and start brushing and taking care of them from today itself. If you aren't already, I'm assuming you are. And as you can see in the picture, your gums receding is also considered an age-related change that, it's also natural. When you're old, your gums start going down. No, it isn't. Again, inflammation and trauma, which has happened to the gums throughout your life, is causing this. It can be prevented if you take good care of your teeth. So last but not the least, dental checkups and preventive care. So I think throughout my lecture, you must have understood so many reasons to go to the dentist, right? And to take care of your teeth, the systemic relationship between your teeth and the pain and the burning and the bleeding and the moving and everything that happens when you do not take care of your teeth. What should you do? Go to your dentist every 6 months or 1 year. Why 6 months or 1 year? Because the hard deposits that I told you, the plaque which is soft, you may be able to clean. With brushing properly, you will be able to clean. But that plaque hardens and it becomes something which is hard and which you cannot clean with your brush, which only your dentist can remove by scaling. So once in 6 months to 1 year, compulsorily, you have to go to your dentist and get your teeth clean. Thank you so much. I end my lecture here. If there are any questions, I'm very happy to take it.
Thank you so much, ma'am, for such a elaborately curated presentation. Thank you so much for your time. Before we move on to the Q&A, I'd like to just take 30 seconds of everyone's time for a quick poll. This will help us get to know you better and tailor future topics that we bring to you. A big thanks to everyone here today. Your presence and participation means a lot to us. While you fill out the poll, I would also like to extend my heartfelt thanks to our esteemed speaker, Dr. Divya Bhatt. Thank you so much, Mark, for sharing your valuable time and insights with us. I request all of the participants to quickly interact with the poll. Rakesh, could you please start the poll again? I can see just it started and ended really fast. Thank you, Rakesh. Requesting all the participants to quickly interact with the poll in the next 1 minute. And if you have any questions, if you want to directly interact with the speaker, kindly use the raise hand tool. You'll find it in the React button at the bottom of Zoom interface. I'm going to end the poll. Uh, yeah. We're going to unmute our first participant. Shmuel, could you please unmute yourself? Unmute yourself.
Yes, you hear me?
Yes.
Yes, please.
Yes.
Okay, thank you very much. Very interesting and very insightful presentation. And I want to ask you a question. What connection between oral health and mental health?
Yes. Thank you. Thank you, sir. So what happens
Thank you.
with oral health? Again, like I mentioned, that there is inflammation, and whenever there is inflammation, it can cause, there is an increased chance of Alzheimer's disease when there is inflammation anywhere in the body. So there is this Alzheimer's is caused basically by amyloid deposition in the brain. And definitely there has been a link that has been found between gum infection and increased chances of Alzheimer's disease. There is a connection, sir. You're right.
Thank you very much.
Thank you, sir.
Thank you for joining us, sir. Um, there's a couple of questions in the chat box. First one is from Shivani, ma'am. Uh, does mouthwash have chemicals which are dangerous?
Yes. I would like to talk about this, that alcohol in mouthwash has been debated and some studies have been done about that, but the amount of alcohol that is there in the mouthwash is very minimal. The other chemicals that are there in your mouthwash do not cause any problems. Usually we recommend chlorhexidine mouthwash. If you go to your dentist and it is indicated in, then he will suggest this chlorhexidine mouthwash is not even absorbed systemically. It works only in your mouth, so it doesn't cause any problems. And this is the mouthwash usually recommended. Even other mouthwashes, when you use it, they do not have any adverse effect. The only thing that people have showed concern about is the alcohol presence. And now you have mouthwashes which do not contain alcohol either, but the quantity is so less, it really doesn't matter. So it's safe to use. You can use.
Are there any alternatives to chemical mouthwash? Can I have a glove or clove? What's the impact?
Yes, you could keep a clove in your mouth. It is found to be to cause pain relief. So if you are having any tooth pain, keeping clove and biting on it is good. Mouthwashes, again, like I mentioned, mouthwashes are indicated only in a few patients. And again, if you're going to these herbal mouthwashes, not many studies have been done. But the reason that a person would be using mouthwash is to reduce the plaque. And to reduce plaque, chlorhexidine is the most effective mouthwash. So if you're going to be using it, chlorhexidine would be a good idea. Otherwise, it's just acting as a physically cleansing agent. It could reduce bleeding. Some of these herbal formulations also, but studies have not been done on it, so I cannot suggest it.
Ma'am, may I know if chewing on neem sticks basically helps or not? Like my dad does it a lot.
Yes, neem stick, it has medicinal properties for sure. But if you're going to use it as the only agent to clean, there could be a problem. It cannot reach all sides, unlike a brush. That is one
Right.
thing. And the second thing is once it opens up, right, it could, cause some injuries in your gums. So while medicinally speaking, it does have good properties and that's a good idea. But to clean your teeth, it's not effective enough because it's not going to reach all areas. One, you cannot do all those techniques with a neem stick, right? It would be pretty hard. And also, once it wears out, it could cause some injuries in your gums. So I do not recommend it.
There's a question from Ms. Jyoti. Kindly unmute yourself, ma'am.
Ma'am, actually, there is a big gap at the top front and at the bottom also.
Yes.
But I am hearing from the parents and everyone that this gap means you are very lucky. And I don't think so. This is that. That is all scientific. And that is all different technical reasons it must be. But this is actually, I think, myth.
Ma'am, lucky or not, I don't think I'm in a position to say. You should tell me. Do you feel you're lucky? If
I'm
you are,
actually
then
lucky.
that's great.
I'm actually lucky and I'm very happy in my life, whatever I'm doing. That is another part. But this is not that. I am not believing.
Okay, ma'am. What I would like to know from a dental perspective is the gap increasing? Or has it been the same since it has erupted? Because if the gap is increasing, I would be concerned. I would say go to a dentist, because if it's increasing, either there are more forces on it or there is a gum infection. If it is the same as it was before, if it's not bothering you, it's fine. The only reason you would worry about it is if the gap increases, then please go to a dentist.
Okay. Thank you.
Thank you.
Thank you so much. An
Thank
excellent
you, John.
presentation.
Oh,
And
thank you so much.
thank you to Vishwa Talk. I think looking towards the topic smile, and you see teeth is the only reason the people, they don't like to smile if that is not beautiful, and that is a very important role each and every minute. So sometimes we hesitate to talk if something, the people, they are artificially putting the clip and all, trying to, set the teeth and all, that is all. And dentist is a very important in our life.
Thank you, ma'am.
Thank you for joining
Very
us, ma'am.
appreciate it.
Thank you. Thank you for this all detailed presentation. And I will again go through the recording.
Thank
you.
you.
Moving on to the next question. The next question is from Mr. Abhishek. After drinking black coffee, I have a bad breath. Any solutions, Divya ma'am?
I have not found black coffee to be causing bad breath, though it can cause stains. Coffee can cause stains, but again, you can rinse your mouth and it wouldn't be, I wouldn't say stop drinking black coffee. That is not a suggestion here. But if you're having a bad breath, then you could just, brush your teeth. You could go to a dentist and find out what is the cause of bad breath, because I do not think it's black coffee. It could be the other reasons that I have listed out before. Right? It could be an oral condition or it could be a systemic condition, either an infection in the mouth or elsewhere, which is causing. Black coffee per se shouldn't cause a bad breath. It could cause staining though, for which you can just rinse your mouth and prevent it from attaching to your tooth. So that would be a good idea.
Thank you so much. The next question is from Mr. Bharat Bhushan Agarwal. Is chewing gum recommended for dry mouth due to reduced saliva?
Yes. Chewing gum is good for having, especially if you have sugar-free gum, it's an excellent idea. Chewing movement will cause increase in saliva. It's good for you. Yes.
Thank you. And there's a question from a guest. How often we should visit a dental checkup if there is no problem at all?
If there is no problem, go once in a year or once in 6 months. Get your teeth cleaned, because the hard deposits cannot be cleaned by you. So, and you may not even notice that it's there. Once in 6 months to 1 year is sufficient if you have no problems.
Thank you, ma'am. Another question from Mr. Bharat Bhushan Agarwal. You said that the type of toothpaste does not matter. However, some dentists recommend fluoride toothpaste. Your views about this?
Yes, thank you for bringing this up question. Thank you for bringing this up. There are certain people who have sensitivity of their teeth. And in these people, definitely fluoridated, there are pastes which have therapeutic agents, right? Most of the pastes do not have. These pastes are recommended by the dentist. So if you have gone and you have, like the photo I showed you, the wear in the teeth, and that may cause a lot of sensitivity, then your dentist will advise a paste which has more fluoride, and you need to use that. So, but what I still suggest is you use your normal paste, because those pastes are less abrasive. So use your normal paste, and after that, apply it, keep it for 5 minutes, and then wash it off. Don't brush it off immediately. Like when you brush, you don't keep it for long. Apply it and keep it for 5 minutes, let it work, and then you rinse it off. Even then, I suggest that you go to your dentist, get your teeth clean, and then use the therapeutic paste so that it has better action. I hope this answers your
Thank you.
question.
Yes. A question from my team member, Rakesh. I drink 5 to 6 cups of tea every day, and my teeth appear yellow. I usually chew gum afterwards. Does chewing gum help protect my teeth, and what would you recommend to prevent tea stains and maintain a good oral health?
Yes, tea, coffee, wine, all these things can cause stains on your teeth. What I would recommend is that you get it cleaned once in 6 months. And after you drink tea or coffee, if you can rinse it off, that would be a good idea, because most of us don't. But if you could just rinse your mouth, that would reduce the stains, and go to a dentist to get it cleaned.
Thank you. Another question from Shivani ma'am. Which brands of mouthwash do you suggest?
Uh, Clohex mouthwash, that is the mouthwash which I mentioned, because it sticks to your teeth. The other mouthwashes, they do not stay for long, they get washed away. Whereas Clohex, it has the ability to stick to your teeth and works for a long time. Have you seen an ad? I think people keep rinsing even when they're, going on dates and they're dancing and they keep rinsing. That's what happens if you use some other mouthwash, because its action is so limited, you would have to rinse multiple times in a day. But Clohex mouthwash, if you rinse once in the morning, once in the night, it's enough. But I don't want to recommend this because I don't know if you need it. Right? If when I tell you blindly here, everyone's going to go and buy it, but everyone doesn't need it.
Right.
So I suggest you find out from your dentist whether you need it and take a prescription from them.
Are there any foods one should avoid while, say, you're having a gum infection, or basically any infection in the gums or anything like that? Any food products one should avoid?
Food products, this is a very general rule that you should not have sticky food or
Right.
food with very high sugar content or sticky food. This is a general recommendation. And if you have gum infection, the only thing that I would say is that if you have uh, gums which are bleeding a lot, there could be deficiency of vitamin C, but it's very rare. Earlier days, they said sailors had vitamin C deficiency, but the vitamin C is in lemon and tomato and everything that we eat. So this I'm doubting. If it is a vitamin C deficiency, you can get it checked. But food to avoid is your routine food only. No smoking, that's the deleterious habit. And avoid sugary food. Even if you're having it, please make sure you rinse your mouth or brush your teeth afterwards. No
Ma'am,
specific
the
thing that you
intakes,
follow.
like anything to do with intakes of acidic or basic?
Acidic food also generally, not only for gum disease, but having a lot of sodas, Coca-Cola or
Right.
sodas or lot of citric drinks, could cause the teeth to wear away. So that should
Correct.
be generally avoided. Again, not for gum disease, but it can cause in anyone.
Generally avoid.
Yeah.
Thank you, ma'am. Can you please tell how to brush once more? I missed that part. Also, should we brush even in the night? And can a 16-year-old also brush in the night? This is a question from a guest.
Everyone. Everyone has to brush twice. I know it's very boring. You're done with the day and you are like, this one more thing tomorrow. That's why I said tomorrow I will start. But no, everybody has to brush twice in a day. My son is 11. He also brushes twice in a day. I make him. So yes, because like I mentioned, in one go, you can't remove the entire plaque. Plaque is where your bacteria are present. And because the technique is so sensitive, it's difficult, right? This technique, keep it at 45 degrees, keep it between your teeth and your gum, move it down. It's hard, right? It's not an easy technique. And also, the areas in our mouth also not easily accessible. So in 24 hours, if you have not removed the plaque, it can cause inflammation. Therefore, within that time, brush twice to make sure the plaque is gone. Okay. No
Thank you,
excuses.
ma'am. Yes.
I'm strict here.
I think the same guest has asked one more question. Recently, gone through an article which says there is a high risk of heart attacks having seen in people having poor oral hygiene. Can you please explain to us more?
Yes. Yes. Inflammation anywhere in the body and even in the gums. Gums, like I mentioned, it's a huge source of infection that you cannot see. Like when they have opened up that area, they have found as much as your palm. Imagine that much of infection in your body, right? And what happens is it leads to, I don't know whether you saw the part where I said the inflammation is protective, right? It is trying to protect your body. But those mediators, they don't kill only the bacteria, they also kill the host cells. They also destroy, damage our body parts. So when these chemicals and these bacteria enter into the heart, now heart, there are two things. The bacteria itself can cause certain conditions like infective endocarditis. So that is a different thing. I'll not go into that. I think what you mean here is heart attacks. So what happens is the blood vessels get thinner. They lose their elasticity, right? Like the traffic jam, this thing that I mentioned. So the blood is not flowing properly to your heart. When the heart vessels get affected by this kind of thickening of the walls and the blood flow is sluggish, then parts of the heart muscle may die, because of which you may have a heart attack. Or also this thickened blood vessels, they may rupture. In parts, they may just open up and immediately the platelets come to repair that and they form a clot. But that clot doesn't get dissolved. It further blocks the heart. Imagine that blood vessel is further getting blocked. Again, blood is not flowing. And sometimes it gets dislodged from there and crosses the blood-brain barrier and it goes into our brain, and that can lead to a stroke. So, it's basically the inflammation. The inflammation, what it's doing, it is working on the inner lining of your blood vessel wall, the inner part of the pipe. It is acting on that and it's allowing the fat to enter. It's allowing the fat. I told you the Trojan horse, right? Like a Trojan horse, it is allowing, otherwise the barrier is stiff. It is opening up that barrier, allowing your white blood cells and fat to enter. And that is getting accumulated. The white blood cells are like Pac-Man eating up all your fat, and one on another getting accumulated, thinning down your wounds. Right? That's how it's going to cause heart disease.
Thank you. Ma'am, before I move on to the next question, I'd like to briefly mention the upcoming talk. We have the rich heritage of Telangana as the topic, exploring its history, culture, literature, and timeless traditions. Dr. Harikrishna Mamidi, Director of Telangana PC Study Circle and former Director, Telangana Language and Culture Department, he's going to speak on this topic on 29th of August, 11 a.m. onwards. Post that, we have menstrual health and common hormonal imbalances in women. Dr. Rachna Chennai, more details available. 19th September 2026, 11 a.m. 12 onwards. You can find the registration link in the chat box shortly. I'd like to unmute Naljoti ma'am again. Yes, ma'am, kindly ask your question.
I would like to just mention one thing, that I am with the environmental laboratory associated, and in the laboratory we are providing for the potable drinking water one parameter that is related to the teeth, that is a fluoride one parameter. And I think the fluoride content is actually more in Rajasthan region in our India, and at our place it is coming absolutely okay. But in the toothpaste also we see the fluoride content. So it is not common for each and every district. So
Thank
that
you
is
for informing us.
Yes, ma'am. This increased fluoride in the water, it can cause dental stains. When it is in certain endogenous part of the country where this is the drinking water which is available with fluoride, it can cause stains in the teeth. And this we can take care of in the clinic with veneers or certain other procedures, bleaching and things like that. We can take care of those discolored teeth which are caused because of this high fluoride in the water. Thank you. That was also a very interesting question from you, ma'am. Thank you.
Thank you. Thank you so much, ma'am.
Thank you for joining us, ma'am. If anybody's missed any part of the session or would like to go through this session again, I'm pasting the link of this particular session in the chat box. Kindly save it, and you can also share it with friends and family, with anybody who find this help. I think everybody will find it helpful. It's just up to you to share it with as many people as you can. Uh, there's another question from Mr. Bharat Bhushan Agarwal. Will stains caused by iron syrups go away after discontinuing the iron syrup, or is scaling a must?
So you would have to get it cleaned. Once there is a stain, you would have to get it cleaned, sir. Yes.
Ma'am, are there any natural things that help you de-stain, like right after eating or something like that?
So there are few pastes like whitening pastes which have a higher level of abrasive, which I won't say they will remove the stains, but they do claim that they have more abrasives which could clean your teeth, make them whiter. However, the problem with greater amount of abrasives, the chances of tooth wear is also more in those cases. So staining, if I could just briefly say, stains could be from within your tooth or they could be from outside your tooth. From within your tooth, like ma'am said, it is because of fluorosis or certain of smoking for a long time may make those stains from inside, or it could be a decayed tooth which has become black. The stains from outside are usually due to either food, mouthwash itself, the mouthwash I recommended itself causes a few stains, or some bacteria cause stains. But these need to be removed with scaling only. There is nothing that we can do at home to remove these stains. In-house bleachers are there. That is for a totally different things. That is for when your tooth is internally stained, but that again your dentist would recommend. I will not be
Right,
able to recommend from here. When you go to your dentist, they will tell you what you need to do for your particular,
right, right,
customized.
ma'am.
Yes.
Which toothbrush, soft or medium for a 72-year-old male, and which toothpaste, medicated or any?
Soft, definitely. And please use a soft bristle brush. Medicated, again, your dentist would have to tell you, because if your teeth are abraded and you have sensitivity, they may suggest a medicated paste. But if you do not have any sensitivity, normal paste is fine. Any paste of your choice, normal paste is absolutely fine. If you have sensitivity, your doctor would need to see why is it sensitive. Is it decay? Is there gum disease? What is the reason? Sometimes even sinusitis can cause sensitivity in our teeth. So they would have to look it up, and then they will tell you a medicated paste if that is going to solve the problem.
Thank you. A question from Mr. Santosh S. What does systematic health mean? Okay,
Okay. So overall health, so systemic as a body as a system. So any other organ is
systemic
affected.
health. Okay.
Yes. Any other part of our body is affected, then we will be saying systemic health. The rest of our body.
Um, there's a question from a PS. This question is for my 14-year-old daughter. There is a gap in between teeth. So please let me know how successful dental braces are, and does age make a difference?
Yes, 14 years is actually a good time to treat. Though we have adult orthodontics, but by 14, all her permanent teeth will be, all her milk teeth would have fallen more than anything else. So it's a good time to have ortho treatment. It does work, ma'am. Find a good orthodontist and consult them. They will see an X-ray. They will see how the bones are related to the teeth, and then they will give you a plan. It does work. It's a good idea to go get a consultation.
Thank you, ma'am. Another question from Mr. Bharatbhushan Agarwal, one of the best webinars I've attended by me,
Thank you so
for which I'm thankful to Dr. Divya. Is it possible to avoid annual calculi removal, because the calculi do come up in spite of best dental care?
Uh, so I would suggest that you go at least once in a year, because a checkup is required. And sometimes calculus also, there are three types of formers: mild formers, moderate formers, and severe. So it depends on a lot of pH in your mouth, and a lot of things will decide how you are. You may have very little, but still, when you have calculus, the basic reason is calculus itself doesn't cause any problem. It's mineralized, but calculus always retains plaque. Like you clean your teeth, you cannot clean the surface of a calculus. That's why it's required that the dentist removes it. Because on the surface of calculus, plaque is always there. That is the problem. I hope this answers.
There's another question from SP Mathur. What precautions should be taken while going for dental implants?
Precautions, I would say that if you're going for dental implants, smoking, I would definitely say should be avoided, because in smoking can affect the success of any treatment. Any dental treatment success can be affected by smoking. Get your blood sugars, your blood pressure, in anything, all these parameters you need to get it checked before planning an implant surgery. Because if your blood pressure is too high or your blood sugars are too high, they will not be able to do it. So go for a routine blood checkup and get your blood pressure measured, and stop smoking. Otherwise, also, especially if you're going for any advanced periodontal treatment, please stop smoking, I would say.
Ma'am, is there a possibility that you develop tolerance from certain chemicals in the toothpaste or mouthwash? Like it stops affecting or something like that? And that's why probably there's newer and newer versions of toothpaste and mouthwashes coming every day.
The formulation of toothpaste, most of them are the same. There is, they keep
Right.
adding new things. It could, be a little more abrasive. It could be a little more this, but overall, like I mentioned, the toothpaste, the abrasives have a cleaning action, but the way you
Right.
use the toothbrush is the most important thing. It's
Right.
not really the composition which is making more of a difference. Those are just, more of, trying to attract people. And there is a feeling when someone is telling me that there's salt in your paste, I'm also thinking, yeah, when I use salt, it was cleaner. Like it's putting that idea in my head, when I see some, foaming crystals, then I'm imagining, yeah, I think my breath is fresher today. So it's more of, you're telling me, so I'm believing it. But per
It's
se,
playing with the psychology.
it's playing on the psychology. It works on me only. I know better, but I'll be like, हाँ, try करते हैं. क्या होता है, try करते हैं.
Even I think the purple toothpaste. So I studied design for my bachelor's, and what I understood it's gimmicky color correction basically. Like you're just canceling out the yellow color by using purple
Exactly.
color. So it
Exactly.
appears slightly white, which is not really white. It's just a duller form of that yellow cancelled out.
Exactly.
So
You got it.
I so okay. There's another question from a guest. Can you please explain once again connection of oral health with Alzheimer's?
Yes. So Alzheimer's disease, they have found, is related to amyloid deposition in the brain. And they have found that whenever there is inflammation anywhere in the body, including in the gums, this deposition of amyloid can increase. So because of that, when there is prolonged, and these gum infections are very prolonged infections, right? They're there for a very long time. So there's a lot of inflammation, and this can cause amyloid deposition in the brain, leading to Alzheimer's. So all these diseases are multifactorial diseases. All of them. When we talk about diabetes, when we talk about heart disease, when we talk about Alzheimer's, it's not one cause, but this is going to make it worse. We are not saying this is the only reason. We have fatty food, smoking. We have so many reasons, right? This is an additional reason. It's not, just the one reason, but it adds to the inflammatory burden. And so the risk is definitely more.
Thanks, ma'am. Another question from Mr. Bharatbhushan Agarwal. Is peanut-sized toothpaste applicable to adults also?
Yes, it's enough. Yeah. We don't need more than that. That's enough.
Thank you, ma'am. I think we've covered all of the questions. I request all of the participants to list down any questions that you have within the next 1-2 minutes, and we bring those up. Ma'am, meanwhile, could you just tell me if you had any, while doing your research, you come across some really bizarre incidences related to tooth ailments, like something that really surprised you?
Okay, I would like to talk about a patient actually who walked into the dental clinic, and this patient went from clinic to clinic to clinic, and they had a lot of pain. And nobody was able to diagnose him. And when you see in the mouth, you don't find anything, right? When I checked, I didn't find anything. But one thing that we have been taught is if a patient is saying pain, he has pain. Trust. He like it's a subjective symptom, right? If he's saying he has pain, he has pain. So you have to come, find out what it is. Then we took an X-ray and we found that the roots of the milk teeth were still there, okay, in his mouth. And they were so tiny we couldn't see it. But we took different types of X-rays, from the top, from the side, and all that, and we found those retained teeth were the source of infection, which had not got caught after multiple appointments. We got it removed, and he didn't come back. So I'm assuming he's fine. So that was an interesting case, such a tiny root is causing so much of problem. What happens is many people will be like, there is a tendency to say this person is exaggerating. He's just assuming he has pain. He keeps coming back. He wants attention-seeking behavior. There is a tendency, but that's not the case. A person comes to you with pain. We believe that they have pain and we come to the source of it. Many times what we see in the mouth, we can't find anything. When we take an X-ray, there is something over there that we find.
Thank you so much, ma'am, for your time. And thank you for patiently answering all of the questions so nicely.
My pleasure. Thank you.
I hope to bring you back on the platform sometime soon with a different topic in the same section. And I request you to kindly join on to the breakout room link that you'll see on your screen shortly. Before that, if you'd like to say anything to the participants before parting ways, please do so.
I'd like to thank all of you. You have been a very active and participatory audience, and you have asked a lot of interesting questions, which I feel were very relevant, and I was really happy to answer them. Thank you so much for spending your time here today with us. Thank you.
Thank you so much, ma'am, for joining us, and thank you for sharing your experiences firsthand with us. And I hope everybody. Yes, Nagjoti ma'am, you will get the official email address onto your registered email ID after the session is over with the copy of the video. The YouTube recording link. So you can watch it again and also find the details there. Rakesh, kindly project the breakout room link, please. Thank you to everyone who joined us today. And I hope to see you next week again at the same time, 11 a.m. onwards. I hope to see you next week. Thanks.